Tonight, when you turn off the light and close your eyes, your body will begin one of the most important biological processes of your entire day. Your heart rate will slow, your blood pressure will ease downward, your brain will begin clearing the metabolic waste that accumulates during waking hours. Sleep, when the conditions are right, is the most powerful form of recovery your body has access to. But here is what Dr. William Li wants every person over 50 to understand before they go to bed tonight. When certain habits interfere with that recovery process, sleep does not protect your heart and brain. It quietly threatens them. Dr. William Li has spent more than 2 decades in cardiovascular medicine, working specifically with adults in their 50s, 60s, and beyond. And one of the patterns that has stayed with him throughout that career is how many serious cardiac events, heart attacks, strokes, dangerous rhythm disturbances, occur not during exertion, not during stress, but during the night. The American Heart Association has documented that a significant proportion of fatal cardiovascular events in older adults happen between midnight and early morning, not because sleep itself is dangerous, but because certain habits that people carry into the night create conditions inside the body that the aging cardiovascular system simply cannot safely absorb. Today, Dr. William Li is going to walk you through 5 of the most dangerous nighttime habits he sees in patients over 50. And then give you a practical, step-by-step evening routine that you can begin using tonight to protect your heart and brain while you sleep. Stay through to the end because the protective routine Dr. William Li shares in the final section has been shown in multiple studies to meaningfully reduce nighttime cardiovascular risk, and it takes less than an hour to implement. Deadly habit number 1, eating a large meal late in the evening. Dr. William Li hears this from patients regularly. They arrive home after a long day, they are hungry, and dinner happens at 8, 9, or even 10 o'clock at night. It feels like a normal part of life, but inside the body of a person over 50, a heavy late meal sets off a chain of events that places significant and sustained strain on the cardiovascular system during the hours it most needs to rest. When you eat, your digestive system requires a substantial increase in blood flow to process the meal. Your heart responds by pumping harder. Your blood pressure rises. Your metabolic rate climbs at precisely the time your body's circadian rhythm is signaling it to slow down and prepare for sleep. If you lie down an hour or two after a large evening meal, that entire digestive process continues while you are horizontal, and the cardiovascular demands continue with it. Research tracking large numbers of adults over several years has found a clear and consistent association between habitual late evening eating and elevated risk of nighttime cardiac events. Beyond the direct cardiovascular load, there is a secondary danger that Dr. William Li considers equally serious. Lying down with a full stomach increases the likelihood of acid reflux. And reflux is not merely uncomfortable, it stimulates the vagus nerve, which runs directly between the digestive system and the heart, and can provoke rhythm disturbances that are particularly concerning in older adults. Dr. William Li cared for a patient, a 66-year-old retired engineer named Bernard, who had eaten large dinners late every evening for the better part of 30 years. One night, he suffered a cardiac event in his sleep. His heart, which had been managing sustained nighttime stress for decades, reached a point where it could no longer compensate. The correction is straightforward. Aim to finish your evening meal at least 3 hours before you intend to sleep. Keep the meal moderate in size and lean in composition. Your heart will have finished the bulk of its digestive work before your head ever touches the pillow. Deadly habit number 2, inconsistent or mistimed medication. For anyone over 50 who takes medication for blood pressure, cholesterol, or blood thinning, Dr. William Li wants this section to carry the weight it deserves. Blood pressure is not constant throughout the day and night. In a healthy cardiovascular system, it follows a natural rhythm, rising during active hours and dipping meaningfully during sleep, a pattern physicians call nocturnal dipping. This nightly dip is protective. It gives the arterial walls a period of reduced pressure during which repair and recovery can occur. But in a significant proportion of adults over 50, this dipping does not happen. Blood pressure either fails to fall or actually rises during the night, a condition called nocturnal hypertension. It produces no symptoms, it generates no obvious warning, and it is one of the most significant contributors to overnight stroke and heart attack risk. Properly timed medication can correct this pattern, and research published in major medical journals has demonstrated that the timing of blood pressure medication, not merely whether it is taken but when, has a measurable impact on nighttime cardiovascular safety. Skipping doses, taking medications inconsistently, or taking them at a time that does not align with the body's pressure rhythm leaves the sleeping cardiovascular system exposed to spikes that can destabilize arterial plaques, promote clot formation, and in the worst cases, trigger events that leave no opportunity for intervention. Dr. William Lee is emphatic on this point. Speak with your doctor specifically about the optimal timing of your medications relative to sleep, and treat that timing as non-negotiable. Deadly habit number 3, unrecognized sleep apnea. Of all the nighttime dangers Dr. William Lee discusses with patients, this is the one he considers most underdiagnosed and most underestimated. Sleep apnea is a condition in which the airway repeatedly collapses during sleep, causing breathing to pause, sometimes for 10, 20, or 30 seconds at a time, before the body rouses itself enough to restore airflow. Each of these pauses drops the oxygen level in the blood. Each drop triggers an emergency response from the nervous system. The heart accelerates, blood pressure surges, stress hormones flood the bloodstream. In a person with moderate to severe untreated sleep apnea, this cycle can repeat itself dozens or even hundreds of times across a single night, every night, for years. The cumulative cardiovascular toll is severe. Studies from major research institutions have found that untreated sleep apnea multiplies the risk of nighttime heart attack and stroke by factors that dwarf almost any other single lifestyle variable. The warning signs are worth reviewing carefully. Loud, persistent snoring is the most recognized, but many people with sleep apnea either do not snore loudly or sleep alone and have no one to observe it. Other indicators include waking with a dry mouth or headache, feeling unrefreshed after a full night of sleep, excessive fatigue during the day, and blood pressure readings that prove difficult to manage despite appropriate medication. Dr. William Lee had a patient, a 61-year-old woman named Patricia, whose husband had mentioned her snoring for years. She dismissed it as insignificant. During a routine cardiovascular evaluation, Dr. William Lee ordered a sleep study. The results showed severe apnea. She had been experiencing over 40 breathing interruptions per hour. Treatment transformed both her sleep and her cardiovascular risk profile within weeks. If any of these signs are familiar, speak with your doctor about a sleep evaluation. The test is simple. The potential benefit is profound. Deadly habit number 4, going to bed without adequate hydration. This is one that Dr. William Lee describes as almost universally overlooked, and it is particularly common in adults over 50 for a very understandable reason. The sensation of thirst weakens with age. Many older adults also deliberately reduce fluid intake in the evening to minimize nighttime bathroom trips. Both of these factors combine to mean that a large number of people over 50 are entering sleep in a state of meaningful dehydration without being aware of it. Here is what that dehydration does inside the body during sleep. As blood volume decreases, the concentration of cells and clotting factors within the blood increases. The blood thickens. At the same time, the heart rate naturally slows during sleep, meaning blood is circulating more slowly than during waking hours. Slow-moving, thickened blood is significantly more prone to clot formation, and clots that form in vessels supplying the heart or brain during the night are among the primary mechanisms of ischemic stroke and nocturnal heart attack. Research has documented a meaningful elevation in nighttime cardiovascular event risk, even with relatively modest levels of dehydration, levels that most people would not consider serious enough to be concerned about. Dr. William Lee's recommendation is practical and easy to follow. Drink a moderate glass of water approximately 90 minutes before your intended sleep time. This gives your body enough fluid to maintain healthy blood viscosity through the night, while allowing sufficient time to use the bathroom before lying down. Keep a small glass of water at your bedside and take a sip or two if you wake during the night. This one habit requires almost no effort and carries a protection that is genuinely significant. Deadly habit number 5, sleeping in a poorly regulated room temperature. Most people think of bedroom temperature as a matter of personal comfort. Dr. William Lee wants to reframe it entirely as a matter of cardiovascular physiology. The temperature of your sleeping environment directly influences how your heart and blood vessels behave throughout the night. When the room is too warm, generally above 24 degrees Celsius or about 75 degrees Fahrenheit, the body works to release excess heat by expanding blood vessels near the skin surface, raising heart rate, and increasing fluid loss through perspiration. These responses collectively elevate cardiovascular workload during a period that is supposed to be one of minimal demand. Research from leading sleep and cardiovascular institutions has linked consistently warm sleeping environments to measurably elevated nighttime blood pressure and heart rate. Cold sleeping environments carry their own serious risk. When temperatures drop significantly, blood vessels constrict in response to conserve core body heat. This vasoconstriction increases vascular resistance, the force against which the heart must pump, and raises blood pressure. In older adults whose arterial walls are already less elastic than they once were, this added pressure can be sufficient to destabilize vulnerable plaques or trigger dangerous rhythm disturbances. European cardiovascular research has documented consistent spikes in nighttime cardiac events during cold periods, with older adults disproportionately affected. The optimal sleeping temperature range is between 18 and 22 degrees Celsius, approximately 65 to 72 degrees Fahrenheit. Within this range, the heart rate remains stable, blood pressure regulation proceeds normally, and the deeper, more restorative stages of sleep are more reliably achieved. Adjusting your thermostat, your bedding, or your bedroom ventilation to stay within this range is a simple and entirely actionable form of cardiovascular protection. Now, here is the practical evening routine that Dr. William Li shares with his own patients, a sequence of simple steps that address each of the 5 dangers and create the conditions your heart and brain need to genuinely recover overnight. By 7 in the evening, finish your main meal for the day. Keep it moderate in portion, light in fat, and low in sodium. By 7:30, take any evening medications exactly as prescribed by your doctor and drink a full glass of water. Between 8 and 9, engage only in calm activity, a gentle walk, reading, or quiet conversation. Avoid emotionally activating content on screens. By 9, set your bedroom temperature to within the recommended range, dim the lights in your home, and place a small glass of water on your bedside table. At 9:30, visit the bathroom, complete your evening hygiene routine, and take any final medications if directed. When you lie down, if you snore or have any reason to suspect sleep apnea, position yourself on your side with appropriate neck support. If you wake during the night, move slowly, sit before standing, pause before walking, and take a small sip of water if you feel any dryness. This routine requires no special equipment, no expense, and no dramatic lifestyle overhaul. What it requires is consistency, and the understanding that the choices you make in the 2 hours before sleep have a direct and measurable impact on what your cardiovascular system experiences during the 8 hours that follow. 5 habits, 5 corrections. Dr. William Li has seen patients transform their overnight cardiovascular risk profile with changes no more complicated than the ones outlined here. Your heart has sustained you through every decade of your life without pause or complaint. The least demanding thing you can do in return is give it the conditions it needs to rest and repair while you sleep. Start tonight. Not next week, not after the next checkup, tonight. If this video gave you something genuinely useful, Dr. William Li asks you to press the like button, leave a comment with one habit you are committing to change, and share this with someone over 50 in your life who deserves to have this information. Subscribe to stay connected with evidence-based guidance designed for the health questions that matter most after 50. Sleep well and sleep safely.